Day 20, and time to check in with Dr. Jeffrey Lowell, professor of surgery and pediatrics at Washington University via Skype, along with Aisha Sultan from the St. Louis Post-Dispatch. Good morning, Dr. Jeffrey Lowell.
Good morning, McGraw and Aisha.
Let's talk a little nursing shortage. There's been a nursing shortage for years. Is it getting any better or is it getting any worse?
Worse. Now, we have a lot of nurses in the United States, like 3 million nurses, but it's not enough, especially with the Healthcare Reform Act, where we're going to be pushing more and more of the healthcare to outpatient settings, which is the best place for it. We're going to need more. Not only are we going to need more nurses, we're going to need more highly skilled nurses, nurse practitioners, as well as instructors, nurse professors to teach all these nurses. And right now, there is a big deficit of both, so that people are interested in finding jobs, professions, occupations. This is a really great one to be thinking about.
We've actually imported nurses from other countries, haven't we?
For a long time,
yes.
Because of the deficit. And, there's an unemployment problem. We're desperate for high quality, compassionate people who are interested in this area. There's tremendous opportunities for both patient care, academics, anesthesia, nurse practitioners, psychiatric field. There's almost limitless opportunities.
There are also hospitals that go out and sort of steal nurses from other hospitals, right? With that hospital list with the traveling nurses, where they go and travel for 6 months out of the year to a different hospital or a different region or something?
Yeah, I'm not sure that's so much stealing as a great opportunity for nurses to kind of see the country, where they can go on contract and spend 1 or 2 years in one hospital in one city and work there and get to know the local environment.
Yeah, all right.
I think one other thing to keep in mind is these are pretty well paying jobs too. The mean salary for a nurse practitioner is almost $100,000 a year.
100 bills a year for a nurse?
Well, Dr. Lowell, let's be real. It's not the easiest job in the world. Nurses do a really tough job, and it takes a special kind of person to be a good nurse.
Absolutely, positively.
Yes.
No doubt about that. And they should definitely get paid for what they do, and most are underpaid. It is incredibly important. It takes, when we're sick, that's who we want taking care of us as a great nurse.
That's a great point as well. All right, let's move on. A couple other interesting things of note. Hospital to home. Explain this new study that talks about how sending people home is actually a good thing.
Well, hospitals are great places if you're really sick. But if you're not really sick, they're not great places. They're filled with sick people, with bacteria and fungus and molds and all kinds of a nasty thing. And most people get better at home. You sleep better at home. You have your own pillow. You have your own surroundings. You have your own food. So there's a big push, not only for the cost, but also for the quality of care to go home as soon as possible. So also as part of the new healthcare reform, we're going to be seeing more and more efforts to keep people at home, and when they're at home, make sure that they stay home and don't get readmitted to hospitals. So this is going to require efforts. So for people who have heart failure, for example, it's very important to make sure that they balance their amount of fluids that they're getting in and out. So making sure that they have a scale and can weigh themselves and can call their doctor or their nurse practitioner to adjust their medicines every day, whether it's for antibiotics or whether it's for food or whether it's for treating infections. These are all going to be really important things, and there's going to have to be some training and involvement of those who are at home helping take care of you.
Do you think doctors will make rounds at homes at some point?
Not so much doctors, perhaps, but advanced nurse practitioners or advanced nurses will. We have a fantastic home health care program in our area right now, where nurses see patients outpatient every single day. And if there's something that needs to get adjusted or something there's a concern, they pick up the phone and they'll give me a call.
Well, Dr. Lowell, in all due respect, if I've had a heart attack, I want to see a doctor. There are some patients that, obviously you don't want to stay in the hospital any longer than necessary, but there are certain cases in which you'd worry about people being pushed out of the hospital too fast to contain cost. Is that something that you worry about?
No. Well, I worry about everything, but I think if you have a heart attack, you will for sure see a doctor. But when you don't no longer need intravenous medicines or no longer need
Right.
uh, um, minute-to-minute nursing care, and you have the ability to be taken care of someplace that's more advantageous, I think that's the best place for you. Now, if that's assuming you have the right skill set of people who are coming and checking on you. If not, then that's not the right place for you.
Let's move on. Something that just gets so under my skin, Doctor. We've talked about it before, and that is it's now vaccine season, right? We're supposed to get all of our vaccines, and you've pointed out that there are a couple of hot spots around the country of these organizations or these groups and these areas that refuse to vaccinate their children.
It's craziness. Now, the one I sent you that made news this week is measles.
Measles.
Measles vaccine. There's a group in Texas that is anti-vaccine, anti-measles vaccine for some reason, and there's a price to pay for everyone because measles is not just necessarily benign problem where you get a rash, you can get very sick, you can require hospitalizations, and you can die from it. And it can affect lots and lots of people now. So that in this one area, the incidence of not being immunized is, upwards of 10%, which is crazy stuff. Measles is something that has all been
Eradicated.
All but eradicated. But now when we have groups like this letting it rear its head again.
Now,
there's gonna be a price to pay.
speaking as a parent who has had, my children have gotten all their vaccinations, and I believe strongly in vaccinations as public health policy, I will say that there are parents who worry about how quickly and how often and how many vaccinations children get very early on now, and that is a change that's happened. So when you talk about measles, it's not just the measles vaccination, it's MMR, and it happens very early. So why are doctors not willing to hear parents when they say, well, can we space this out? Can we wait a month? Can we wait until the baby's not a week old but 4 months old? How do you deal with parents who bring those concerns to you?
Well, I'm not the expert in designing the sequencing of how often you need and what is compatible with not, and what can interact with other things, but all are important. And so I guess there could be studies to be done to see what happens when you space them out and do one every month. But I think
Here's what I don't understand, Doctor. Here's what I
most
understand.
parents don't like getting shots. I mean,
It's
people
not
don't
just
like
that.
it,
It's
but-
that
But
people
hold
feel
on,
like
but-
there are
okay.
risks
All right, but hold on a
to
second.
overloading a child's immune system
But,
at that young of an age.
But an accountant who's a mother who brings in their child is going to tell the doctor who's been to school for 15 years what the shot sequence should be. I mean, there's been study after study after study, and there's no evidence of anything of any harm doing any baby because of they're getting the measles on top of this shot, on top of that shot, and yet some mother who has no medical training is going to come in and tell the doctor, I don't want my measles shot too soon.
McGraw, who prescribed mothers thalidomide? Doctors did. So when the doctors are not infallible, and my husband works in healthcare, and like I said, I believe in the medical system, but you cannot discount the concerns of parents, and that's what leads to groups who become very distrustful. It's because they don't feel like their voices are heard. They feel like their voices are dismissed in this discussion.
Doctor, you want to chime in? No.
No,
All right, there you go. All right, Doc.
I'm not really sure what the concern is.
Well, the concern is that there are people who feel like overloading a child's immune system at that young of an age can cause other problems.
Well, what's the evidence of that, and what does overloading mean?
Well, I mean, I have a friend whose child has epilepsy, and she is convinced, she's an educated woman, she's married to a physician, that the fact that he had to get all these immunizations had something to do with that.
But there's no evidence to that.
There's no evidence.
She can believe it all she wants, but there's no evidence of it.
Well, I'm just saying that if our concern, if the policy implication is to get more people to buy into vaccinating their kids, then look at what the concerns are and find ways of addressing those, even if you feel like they're ridiculous.
That is Aisha Sultan. Dr. Jeffrey Lowell is via Skype. He's a professor of surgery and pediatrics at Washington University. Doctor, thanks for checking in. A little energy today, huh?
It's good. I hope the cards get some energy tonight too.
From your lips, yes.
Thank you, Doctor. Have a good week. 8:29. You got it. 8:29 here on the Big 550 KT.